I've very much enjoyed being part of the scientific committee, which allows the NCRI clinical studies groups, the breast group in my case, to get involved with the planning and then the running of this fantastic conference. The NCRI Breast Clinical Studies Group has been phenomenally successful. For example, last year, almost a quarter of patients going into clinical studies, clinical trials, were patients with breast cancer. That's some 13,000 or more women. And over the years, we've transformed the way treatments are given for surgery, radiotherapy, and drug therapy for breast cancer.
This poster, we put this in and we applied for the Student Bursary Prize Award. I was fortunate enough to receive the prize shown by the Rosette. So this is just a bursary that goes towards the funding of conferences, travel expenses for early researchers, PhD students. Don't be afraid to get out there and share your work. You work hard, you've got to get out there and show it and share it.
If you present your poster, you will get benefits with increasing confidence and increasing the amount of people that see your work, as well as promoting where you work as well.
The amazing strength of the NCRI conference is the diversity in the people who attend. You've got scientists, you've got doctors, but you've also got research nurses, you've got people who run clinical trials, you've got people from the charity sector, from the drug companies, and not everyone is a scientist. So they can sometimes get bamboozled by some of the terminology used, and yet they are so important to the conference. It's where the conference's strength comes from, is bringing the whole cancer community together. The aim of my session was to aid that communication and aid understanding, so that when a research nurse talks to a scientist, they can find common ground. They can actually speak to one another in a language they both understand.
Caris is a very small company that has just expanded into Europe, and we felt this was the ideal platform to introduce ourselves to the UK's oncologists. For me, it's been excellent. There are a lot of oncologists who I have had difficulty in getting a one-to-one meeting with, and I've managed to catch up with those guys here. So it's been a perfect setting.
I think it's a great place for young scientists to come and present their breaking science work and actually then interact with other scientists in the similar areas. So a great meeting overall, I think, particularly for young scientists to present some of their data maybe for the first time.
It's really important in the NCRI conference to have quality, to have topicality. We want this conference to be one that people can come away with having learnt a lot, but also really having a vision and being inspired about where cancer research is going.
I think the 10th Cancer Conference is an opportunity for us to do a number of things, not least of which is to look back next year and say, well, where have we come over the last 10 years, both through the virtue of the conference, but also as an NCRI partnership and as a group of funders in the UK. But it also gives us a point in time from which we can look forward and say, what do we think might happen over the next 10 years? And these are questions that matter to people. It matters to people how far we've come over the last 10 years and what might happen over the next 10 years. So I think it gives us a great opportunity to think about those questions.